If your child normally has well-formed, easy-to-pass poops, and all of a sudden the poop becomes loose, watery, foamy, has undigested food in it, or is accompanied by cramps, your child probably has an acute case of diarrhea. If your child has a couple of unformed bowel movements or more frequent BMs in a given day than usual, this generally is not considered diarrhea. The main thing you can do at home is to let their bodies release what they have to. Gently encourage firmer stools with some easy, bland food choices, and above all, keep your child hydrated. When stools are watery, your kids are losing a lot of fluid. In Chinese medicine, diarrhea is usually put into one of two categories when it comes on fast. It's either considered hot or cold. For your purposes at home, this distinction won't matter as much as it would to your child's practitioner. Here are some ways to decide at home if your child has the hot or cold type diarrhea. If your child has the hot variety, your child's poop smells strong and foul. Your child complains that his bum stings or burns after diarrhea. Your child is running a fever along with diarrhea. You place your hands on your child's belly and it feels hot. Your child's cheeks are flushed. On the other hand, they may have the cold variety if the poop hardly smells, the poop is watery, pale, or greenish. Your child has a minimal fever or no fever at all. You place your hands on your child's belly and it feels cold. Your child appears pale. Just to confuse matters for parents, some kids alternate between the hot and cold varieties, depending on where their body is at in the process of healing. Some may not seem clearly to be one or the other. Don't worry, just massage the general points that I talk about, and always watch for dehydration. Here are some points you can stimulate or massage if your child has either hot or cold diarrhea. A great place to begin with diarrhea is a point that you may have seen in other sections. You are going for the area that is located on your child's lower leg, about 4 of your child's closed finger breadth from the base of the kneecap, on the outside of the tibia bone. Again, that's the bone that runs down the center of the leg. Often you'll feel a slight depression here the size of a dime. You can massage this point or place a magnet on it on both or either leg. Like we discussed before, this is another point that's almost universally useful. One of its most profound functions, however, is its ability to harmonize an upset stomach. Another technique that you may have used before from other sections is making circles on your child's palms. Holding your child's palms in front of you in a comfortable position for you both, begin making circles around the inside of the palm with your thumb. This time, unlike other sections, you'll be going counterclockwise on the right hand, clockwise on the left. Continue rotating for at least 100 times or a couple of minutes. 2 more points that are useful for almost any type of diarrhea are located on your child's abdomen. To begin, you can make gentle but firm circles counterclockwise on your child's abdomen. Then, after a few minutes, move your fingers up to the area located on the midline of your child's belly, halfway between her navel and the bottom of her sternum. Using the pad of your thumb, gently apply pressure and rotate your thumb clockwise for a few minutes, or a couple 100 times. After this, move to the level of the belly button. Press on both sides of the belly button at the area about halfway between the belly button and the nipple line. You can press and rotate here gently for a few minutes, again, maybe 100 times, to help stop diarrhea and regulate digestion. If your child has cold variety diarrhea, the most effective way to get results in my experience is to warm the points. You can use a hot water bottle or a buckwheat pillow laid in the general area of the points described. Test the temperature of either against the inside of your wrist. The idea is to gently warm, not to burn. Leave the bottle or pillow on the area as long as it's comfortable for your child or until it cools down. For example, at the area on the outer edge of your child's tibia bone on the lower leg, lay a hot water bottle or buckwheat pillow lengthwise so that the entire area along the tibia bone is getting warm. You can also lay the hot water bottle or pillow on the tummy, directly over the umbilicus, which is your belly button, and slightly below it. For hot diarrhea, I generally recommend just massage or magnets. We want to avoid adding additional heat to your child's body. If your child is obviously hot, I also recommend adding these points. The area directly between the outer crease of the elbow when the elbow is bent and when the thumb is facing out, and the funny bone, and the area between the second and third toes on the top of the foot, just a hair's breadth below where the two toes join. Spend 2 or 3 minutes pressing or press rotating at each of these locations. It used to be common advice not to feed a child who had diarrhea. This is not considered the best approach now. Solid food can actually help the intestines to absorb more water, which will slow the diarrhea down. It is also important to give your child nourishment so they have the energy to fight the invaders and regain their health. So by all means, do feed your child solid foods. Because their digestion is already upset, however, you'll want to stick with foods that will be easy for their systems to digest. Some beneficial foods and drinks that you can incorporate to help your child's poop to firm up are rice water. You'll simmer rice in about 4 to 5 times the amount of water for 20 minutes or so, let it cool, and have your child drink the cooking water. Bananas, guava, which is a tropical fruit that you may be able to find at your grocery store. And I recommend avoiding dairy products, greasy foods, sugary foods. While your child is having diarrhea, all of these are hard on the digestive tract. I do not recommend giving your child any over-the-counter medications to stop diarrhea unless you need to go on a long road trip, for example, or unless expressly recommended by your health professional. Even though these medications may help get rid of the unwanted symptoms in the short term, they will prolong your child's illness in the long term by trapping unwanted bacteria or viruses in the intestines, where the unwanted invader continues to reproduce and thrive. Get them to the exits.